Hi all. I am going to make a video here to show you how one might do the evidence-based presentation. And I'd like to thank everybody who did the mid-course survey. 6 people did, and within the survey, I saw that many of you found these videos to be very helpful. So I'm making this video now. So if you haven't filled it out, it's in the Units tab under Unit 7, and right at the bottom there's a link to the mid-course survey. So please fill that out. I do respond to every suggestion in there, so appreciate the feedback. So we're going to be talking about the evidence-based practice presentation assignment. So if we go into the assignments, my screen might look a little different from yours, but at the bottom we have this evidence-based presentation document that will give you instructions on how to do this. I'm going to use an article that I wrote, and some of you have already seen, to give an example of how this evidence-based practice might work. So this is the article here that I'm referencing, and here are some slides I've created and I'm going to share with you. So first of all, we start off, you have a nice little title slide with the title of your EBP project. The second slide, you might have something like the model in there. So you can just cut and paste this slide that I've created here into your own PowerPoint presentation. And you'll just walk me through the process that you've done to do this evidence-based practice project. So first, of course, we start with the inquiry. We're in a clinical situation, and we see something that we're wondering if it's the best way to do. We develop a PICO question, which is a formulated question that makes it easier for us to go in and look up the evidence. So go to the databases with keywords, look up evidence for us to critically appraise and summarize and make implications for practice or translation to practice. So first, background and significance. So as I was working as a diabetes educator at City of Hope, I noticed that a lot of my patients were post-hematopoietic cell transplant, and they would come to me and they would have hyperglycemia. And some of them would ask me, is having high blood sugars, is that going to affect my recovery from my bone marrow transplant? And I really had no idea. So that's why I undertook this review, or that's why I'm asking this PICO question here, to see if hyperglycemia how it affects people who have had a bone marrow transplant. And this is important to know for preventing any adverse events or outcomes that might occur due to hyperglycemia. So my PICO question is, my population is adult, bone marrow. I say bone marrow because it's easier than saying hematopoietic cell transplant, and most people know what a bone marrow transplant is. So in adult bone marrow transplant patients, the I is safe and effective glycemic control. The comparison is usual or standard care, and my outcome is going to be patient outcomes in general. So my question in adult HCT in patients, what is the effect of safe and effective glycemic control versus usual care on patient outcomes? So my literature review, what I did, I went to Pollitt and Beck and looked at table 2.1 and put my PICO question in there and found some keywords here. So my keywords are underlined, the ones I looked up. So I had hematopoietic cell transplant, I had glycemic control, and patient outcomes. My inclusion criteria were peer-reviewed articles within the last 10 years in the English language. I searched 3 databases, PubMed, Medline, and CINAHL. Initially, I found 33 articles. After I removed duplicates, 29 were left. As I went through the articles, I found 3 additional articles that I incorporated in here. So the number of abstracts that I looked at were 32. I excluded 20 of these abstracts because of these reasons here. So I was left with 12 full text articles that were that I looked at. So none of these were excluded, so I had 12 left that I included for my review. So the way I kept track of these 12 studies was to make a table. Because I was doing this for a manuscript for a journal, I made a table that was pretty comprehensive. Here I have my study design over here. I had the level of evidence, the purpose and aims, my patient population, the outcomes that were measured, the findings, and the conclusions over here. Expand that so you can see a little bit more. There we go. So my conclusions here. So really, what I ended up doing with this table is in the findings, I underlined what the outcome was that was in the findings. So neutropenic infections, I had febrile, what did FN stand for? Febrile neutropenia, organ dysfunction. So in the findings, I really kind of grouped them into what types of outcomes, so categories of outcomes that patients that were seen in these different articles that I reviewed. So length of stay was one that was in this study. So that really helped me in the end to write up this integrative review. So nothing you have to do for this. What you should do on this slide here is include your summary table here. You do not have to put all your critical appraisals that you did, just a little summary of what you found here. Okay, and then for the next part of this was the conclusions for practice. So here you can include your Appendix H and discuss how many articles and what the level was in the quality and how that related to your PICO question. Next, you can include a slide about major findings. So in mine, I had findings that there were some associations between hyperglycemia, infection, time to engraftment, development of acute graft versus host disease, length of stay, toxicities, and overall survival. I also found there were patient-related risk factors for hyperglycemia, such as older age, insulin resistance, increased BMI. Interesting finding was that normal weight patients who were experiencing hyperglycemia had worse outcomes than overweight and obese patients. And then there were also treatment-related risk factors for hyperglycemia, and these were the dose and duration of steroids, if there was any treatment with anti-hyperglycemic medications, and the use of TPN. The limitations that I noted when I was looking at the evidence was that there was no concrete definition of hyperglycemia, and the collection of blood glucose data, it didn't say if this was fasting or not fasting. So another limitation was that all of these studies were retrospective design, so 10 of the 12 of them looked at past data instead of actually going prospectively, setting up a study and looking at hyperglycemia in real time. So therefore, some of the implications for research were that to conduct more research. So do conduct prospective studies where you can see um, if if the blood sugars are being collected, if they're fasting or postprandial, and test alternatives to treatment. See if any of these, for example, not using TPN or using normal saline instead of D5W or something like that. So prospective studies would actually let us to test these variables and see what kind of associations they had with patient outcomes. Implications for practice based on the evidence is that we know that management of hyperglycemia during this acute phase post-HCT is an important time, and it's important for the transplant nurse to be involved in this. The transplant nurse should therefore have an increased awareness of glycemic issues in patients. They're often there when planning the care for patients. They're delivering medication, communicating with the interdisciplinary team. They're 24/7 with the patients. And we also saw, as a result of this, the evidence that was out there, some of the implications were that really to have some earlier control of glycemia, and this could mitigate some of those adverse events related to poor glycemic control. So I'm also including some references here. So for this exemplar, I have 14 slides. It should take about 10 minutes for me to go through all of these slides and for you as well. So let's say we have a limit 15 to 20 slides, and that you should take about no more than 10 minutes to present your presentation. So what I'm going to do is, because I've got this video to you so late, was let's extend the deadline for this EBP presentation assignment. I'll extend it till Tuesday, and that'll give you time to watch the video, incorporate any of the ideas presented here, ask me questions about it. Good luck with this assignment, and I'm standing by for questions.